So once again, I'm your moderator today, Krishna Horrigan, and our presenter here is Sarah Murdoch, Director of Client Services at Medicare Rights Center. And I think at that point, I'll hand it off to you, Sarah, and we can begin your presentation.
All right, great. So thank you so much for having me. I'm really excited. I'm actually, the Medicare Rights Center is based in Manhattan, but I'm actually a resident of Westchester myself. So I'm really happy to be with you all, as part of my own community. So thank you for having me. So let me just go ahead and share the PowerPoint. Everybody can see that? Krishna, we're good? Okay, great. So great, thank you. So we're going to go over Medicare basics and then a couple of topics that have sort of arisen out of the pandemic, and I'm happy to answer any questions, but we'll just go ahead and get started. So just so you all know kind of what the Medicare Rights Center is, we're a national nonprofit. We are based in Manhattan. We serve many, many New Yorkers, and we do this through 3 ways. So first, we do counseling and advocacy. We have a beneficiary consumer helpline that you can call. It's a 1-800 number. So you can call it with any Medicare question, and one of our counselors will help you troubleshoot and try to solve your Medicare issues. We have many educational programs. So we do webinars like this. We have a webinar series on our website called Medicare Interactive Pro. We have a Medicare Interactive site that's sort of like a encyclopedia of Medicare information, and then we do public policy initiatives both in New York State and at the federal level. We have several policy people working to improve, strengthen, and protect the Medicare program. So just to give us an overview of the presentation, we're going to go through the basic pieces of Medicare, understanding the different types of coverage and cost. We're going to go over Medicare Part D in a nutshell. We're going to summarize the basics of Medicare coordination rules and go over some of the Medicare cost assistance programs. And then last but not least, some other resources that are out there for folks if you need help. So we'll start with Medicare basics. So just right off the bat, what is Medicare? Medicare is the federal program that provides health insurance for people 65 and up, or individuals who are under 65 but have been receiving Social Security Disability Insurance, SSDI, for at least 24 months, or individuals who are under 65 and have kidney failure in need of dialysis or transplant, so also known as end-stage renal disease. Medicare is not means tested, so there's no income requirements, there's no asset requirements. Most people are eligible based off of just being a citizen of the United States. And there are 2 ways that people can receive their Medicare benefits. So first, there is Original Medicare, which is the traditional Medicare program offered directly through the federal government. And then there's Medicare Advantage, which are private plans that contract with the federal program, and people receive their benefits via the Medicare Advantage plan. And we'll go into that a little bit more later in the presentation. So first we'll start with the different types of eligibility. So if people are eligible due to age, meaning they've reached age 65, people qualify if they collect or qualify to collect Social Security or railroad retirement benefits. So again, it's not, you don't have to be collecting. Many people wait to their full retirement age of 67, or they wait till they're 70, but you're still eligible for Medicare when you turn 65. If you're not eligible for Social Security or railroad retirement, but you are a US resident and a US citizen or a permanent resident, meaning a green card, and you've lived here for 5 years, you're also eligible for Medicare. For folks who are eligible under 65, they'll qualify if they've been receiving SSDI for at least 24 months. For one kind of specific situation, individuals that have ALS, there's no waiting period. So as soon as they start receiving SSDI, they will also be receiving Medicare benefits as well. Compared to any other kind of disability, there is a 24-month waiting period. And individuals who have end-stage renal disease also may qualify, depending on their history, their family's history, and whether or not they have enough credits on the system. So moving on to the different parts of Medicare, it's sort of like an alphabet soup of Medicare. So we have Part A is covering hospital inpatient benefits. So, if you're admitted to a hospital, you're in a skilled nursing facility for rehab, something along those lines would be Part A. Part B is doctor and outpatient benefits. So that's anything like your primary care doctor, a cardiologist, kind of normal doctors that you see on an outpatient basis. And then Part D is a prescription drug benefit. So, medications that you pick up at your CVS or your local pharmacy, whatever pharmacy is what is Part D. Part D is offered through standalone prescription drug plans. So there's no federal version of Part D. It is all through private plans. And then as I mentioned before, the other option is Medicare Advantage. So you have your A, B, and D rolled into one plan, which is the Medicare Advantage plan. Those are typically HMOs or PPOs. It's, getting all the benefits through one streamlined plan. You're getting it through a private company rather than the federal government. And I think it's really important to note this isn't a separate benefit. People still have Medicare, they still have A and B, it's just being administered through a private company rather than directly from the Medicare federal program through CMS, the Center for Medicare Services. So now that we know about eligibility and the different things, we're going to go through the different ways that people might enroll in Medicare once they are eligible and ready to enroll. So we have automatic enrollment, initial enrollment, general enrollment, and special enrollment periods. So automatic enrollment, if people are receiving Social Security retirement benefits or railroad retirement benefits prior to turning 65, so if you start collecting at 62, 63, 64, when you turn 65, you will be automatically enrolled into Part A and B the first of the month in the month you turn 65. So for example, my birthday is in February. When I turn 65, my Part A and B will be in effect on February 1st. If people are eligible for automatic enrollment, they should receive a package in the mail 3 months before the coverage starts with the card. Hang on to that, hang on to any of the paperwork, and just be aware of the timeline that your Medicare will be in effect. So this also kind of aligns with the initial enrollment period. That is the 7-month window surrounding your birthday month. So it's the 3 months before, the month of, and 3 months following someone's 65th birthday. So coverage dates depend on when the person enrolls. So if you enroll in 3 months prior to your birthday, your coverage will start the first of the month in which you turn 65. If you enroll during your birthday month, it'll be the next month, and any of the months after that, it's sort of like a rolling, staggered based off of the month you enroll. So for folks who were not automatically enrolled or didn't actively enroll during their initial enrollment period, there are 2 other options. The general enrollment period is available to anybody who did not enroll during their initial enrollment period. It's always January 1st through March 31st every year. People that sign up during the general enrollment period will have coverage starting in July 1st. And unfortunately, using the general enrollment period may mean that you can incur a late enrollment penalty. So it just depends on how long you went without coverage and whether or not you had coverage from employer coverage instead. So if you were working, that would potentially be not subject to penalty. The special enrollment period is times outside of these other enrollment periods that we mentioned. It's very often based off of somebody retiring, you're working, you have active employer coverage, you retire, and then typically people would have the special enrollment period to pick up Medicare at that time. If you're eligible for the special enrollment period, there's no late enrollment penalty, there's no gap in coverage. So, it's very useful for folks to research that if you think it would be applicable to you, and that's something we get many calls about on our helpline. So if you think that is something you have a question about, feel free to call us.
So Sarah, could I stop you just for a quick
Sure.
question in the Q&A?
Yeah. Yep.
Somebody said, did you say I could have waited till 67 to join Medicare? So can you expand on a scenario where that would be the case?
So you can only wait if you have, if somebody is still working and has coverage from that work, from that employer. So not coverage through the marketplace, not coverage from a retiree plan from another job, not something like that. If you're working, have coverage through that job, or your spouse is working and you have coverage through their job, you can delay Medicare enrollment until the point you retire. If you don't have active employer coverage and you're turning 65, it is very, very important to enroll in Medicare timely, because if you don't, that is potentially when the general enrollment period comes into play. That's when potential penalties come into play. So again, if people are really not sure what to do, we're happy to speak with people on an individual basis. But yeah, the one kind of protection is if you're working and have coverage from that work past 65, you can potentially delay. But always double check first before you do it. We don't want to, have people miss enrollment periods.
Thanks, Sarah.
Thank you. All right. So Medicare coverage and costs. So these terms to know are just health insurance terms. These are not specific to Medicare, but often we see them popping up in Medicare all the time. People have questions about them. So the premium is a monthly amount an individual pays to have Medicare, a Medicare Advantage plan, or a Part D plan. So it's a monthly amount. The deductible is amount that the individual has to pay out of pocket before their insurance kicks in and starts also paying for services. A co-insurance versus co-payment. I think often people get these confused, but a co-insurance is a percentage of the total cost that Medicare or the plan has paid for. So in Medicare, it's typically 20% co-insurance. So if the full cost of your service was $100, you would owe a $20 copay, because that is 20% of 100. Versus a co-payment, it's a kind of set fixed amount that you pay for each medical service. So this is more like a $20 copay for each doctor's visit, or a $50 copay for emergency room visits. It's always a set dollar amount versus a percentage. So Part A covers, as I mentioned, inpatient care. So if somebody is formally admitted into the hospital by the admitting doctor, it covers, in some instances, inpatient skilled nursing facility care. So this is if you've spent 3 nights at least as a hospital inpatient and you need to get rehab through a skilled nursing facility, a SNF, that would be potentially covered by Medicare. It's really important to note that this is not the same as long-term care. People are needing to be permanently living in a nursing home, then this is not what you're going to get coverage for. It also covers home health care. So people are homebound and need skilled care. So skilled care, again, different than long-term care. It's physical therapy, occupational therapy, things that you need, skilled nursing that you need in your home to be treated at home. The doctor must approve services that must be received from a Medicare certified home health agency. And last is hospice care. So people who are terminally ill, unfortunately, but will potentially need this kind of care, hospice is covered through Medicare Part A. So Part A costs, there is no premium if people have at least 10 years of Social Security work history. And it's just 10 years over the course of your life. It doesn't have to be 10 consecutive years. We know that many people take breaks for whatever reason from employment. So it's just 10 years over the course of your life. If somebody does not have that work history, then there is a Part A premium that's sort of scaled to how many years of work history the individual has. So if you or your spouse has worked and paid Medicare taxes for 7.5 to 10 years, the premium in 2020 is $252. And if you've worked fewer than 7.5 years, it is $458. So it can get quite expensive if you don't have the work history, but generally speaking, most people do qualify for premium-free Part A. The hospital deductible is $1,408 for each benefit period. And so you can have multiple benefit periods in a year, but it's that for each benefit period. The hospital co-insurances, so meaning if you're in the hospital for a very extended period of time, from days 0 to 60, it's $0 copay, but if you need to stay there longer, unfortunately, if you need that kind of long intensive care, then the copays are going to go up to $352 per day for 61 through 90, and then for days beyond that, $704. So it can get a little bit more expensive. And then last is skilled nursing facility co-insurances. So people need to go to a SNF for rehab and recovery. Again, it's $0 for days 0 to 20, and then $176 for days 21 to 100 in each benefit period. So moving on to Part B, as I mentioned previously, this is outpatient care. It's care provided by professionals, just on a sort of normal basis. So doctor services, like your primary care doctor, preventive services, care to keep you healthy, home health care, similar to, covered under Part A, but it's used to treat illness or injury in the home, and durable medical equipment. So things like a wheelchair, for example, would fall under the category of durable medical equipment. So Part B costs, there's an annual deductible of $198 per year. There is a monthly premium of $144.60, which if you are collecting Social Security will just be deducted from your Social Security check. If you are not collecting Social Security, it will be billed to you directly. And you can just pay with check and work with the Social Security office to set that up. And then there are co-insurances. So Medicare pays 80% of the Medicare approved amount for a service, and the beneficiary pays 20%. So that's just going to depend on what the service is, how many services you get, but it will be 20%. So talking about A and Part B, you can kind of see that if you did not have any secondary insurance, those costs could potentially add up. And one way to prevent that is to look into Medigaps. Medigaps are supplemental insurance that help pay the costs associated with original Medicare. They don't assist with Medicare Advantage. So these are private health insurance policies, again, only working with original Medicare. And they only pay for services that Medicare approves. So if you see a doctor that doesn't participate in Medicare, you get a service that isn't covered by Medicare, the Medigap is not going to pick that up. Medigap's premiums range from around $100 to, we're seeing kind of a maximum of $300 a month, depends on your geographic location, your county. There are 10 standardized plans, A, B, C, D, F, G, K, L, M, and N. And they all cover sort of a different standardized set of kind of packages of what it covers with Medicare. So you would kind of look at the different plans and see what kind of covers what you anticipate you'll need. So basic Medigap benefits, what all the Medigaps covers, they all cover that hospital co-insurance that we talked about. They cover 365 days of full hospital coverage on top of the Medicare covered days, full or partial coverage for Part B co-insurances, full or partial coverage for the first 3 pints of blood you might need if that's something you need, and the hospice care copays. So it basically covers a lot of those costs that are not, that the beneficiary would be responsible for if they did not have a Medigap or other secondary coverage. Things that Medicare does not cover, so it does not cover most dental care, it doesn't cover most vision care, so meaning if you need glasses or contacts, it doesn't cover routine hearing, so hearing aids are out. It doesn't cover most foot care, long-term care, so again, if people are being placed in a long-term care facility, It doesn't cover alternative medicine, so anything like acupuncture or holistic medicine is not covered. It doesn't cover any care outside of the US, so if you go abroad or you go to Canada, Mexico, is not going to have coverage. It doesn't cover any personal or custodial care if there's no need for skilled care. So if somebody has a home health aide and needs assistance with preparing food, bathing, getting dressed, that's not covered. And it doesn't cover most non-emergency transportation. So anything other than kind of an emergency in which you need an ambulance.
Sarah, a few more questions.
Sure.
So I think these came up at Part A. So is there a limit, for example, a number of days for home health care or hospice care?
Sorry, is there a limit of the number of?
Number of days for home health care or hospice care, or another type of limit towards that kind of service?
So there's no limit, but you typically have to get recertified for the benefit. So if, and sort of the doctor would demonstrate that you're still in need of that kind of care. So for example, home health care, if you needed home health care after a knee replacement, at some point, hopefully you won't need that anymore. So it was like I think it's 6 weeks or so, they will have to recertify the need for that benefit. And the same with hospice. It is kind of based off of like a rolling 6-month certification process, because sadly, people that need hospice, it is sort of based off of the qualifications that you have a terminal illness. So if you kind of go beyond that, they will recertify you. But yeah, there's no kind of like finite limit. It's based off of, your ongoing needs.
Okay, and could you please define the benefit period in a little bit more detail?
Sure, so a benefit period, starts when you're admitted to an inpatient setting. So for example, a hospital. So that's like day 1 of the benefit period. And the benefit period ends after you have been discharged for at least 60 days. So the benefit period is not again, it could be like any length of time really. So it's like, it just depends on how long you're in and then how long you're out. So if we say somebody was admitted and they were in the hospital for 10 days and then they went to a skilled nursing facility for 20 days, when they're discharged from the skilled nursing facility is when they would need to have 60 days pass before they could start a new benefit period. So in some ways that's good. If you've paid that hospital deductible and you need to be readmitted to the hospital, you're not going to have to pay that deductible again. So yeah, it could be, you could have one benefit period in a year, you could have multiple benefit periods in a year. So it just depends on how long somebody is in.
Okay. And then another question, is there any penalty if you purchase Medigaps after your initial enrollment period? So if you delay?
So in New York, we have more, we're lucky that we live in New York. There are more protections for Medigaps. There's no penalty. The premiums are the same for everybody, in your county. So if we live in Westchester and the premium was whatever it is, that premium will be the same whether somebody's 65 or 100 years old. The one thing is if you didn't have a Medigap and you didn't have any other kind of what they refer to as creditable coverage prior to your Medigap enrollment, you could potentially have a pre-existing condition waiting period, meaning for 6 months they're not going to cover any pre-existing conditions. And so that's like the one downside of waiting to enroll into a Medigap, but the premiums don't change. There's no penalty on Medigaps. Any other questions?
Is the Medicare Advantage plan considered a type of medical insurance, or is it two different things? I think someone's asking if the Advantage plan is considered an insurance plan or insurance coverage.
Yeah, so Medicare Advantage is a type of Medicare coverage. It's through an insurance company. So we see Medicare Advantage plans through places like Humana, United Healthcare, This is an endorsement of those, but just, examples. So yeah, it's a type of coverage through an insurance company in which you get your Medicare benefits through a private insurance company versus through the federal government.
Perfect. I think we can move on.
All right, thank you. All right, so moving on to Medicare Part D, the Medicare prescription drug coverage. So it's the outpatient prescription drug benefit for anyone with Medicare. So you're eligible for Part D if you have Part A or B. Again, it's only available through insurance companies. There's no kind of federal version of Part D. And there's two ways people can get their Part D benefits. So if you have original Medicare, A and B through the federal government, you can purchase a standalone prescription drug plan that covers only your prescriptions. Or if you have a Medicare Advantage plan, Part D is almost always included in the Medicare Advantage plan, and you would go through that plan for your A, B, and D prescription services. Everyone is responsible for a monthly premium, and individuals with low incomes can get help with costs, which we're going to touch on those programs later, but just be aware that, if you're struggling with your prescription drug costs, there are programs out there that can assist. Part D coverage is, each Medicare drug plan has its own what's known as formulary. So it's a list of covered drugs, meaning the plan will only cover drugs on that formulary. But they are meant to be kind of expansive, so they must cover at least 2 drugs under each type of drug class. They must cover substantially all drugs from a few classes, and they have to cover, a few classes of drugs are excluded from Medicare entirely. So it's important to research your Part D plan, think about the drugs that you're taking before you enroll, and check it with the Part D plan's formulary. Each plan charges different premiums, deductibles, and copays. The national average premium is $32.74 a month in 2020. But we see, some plans cheaper than that, some plans more expensive. It just depends on what your needs are. And then, based off of this formulary, this list of drugs, they're going to place the medications into different tiers, and the tier will determine the cost of the drug. So lower tiers are always cheaper. So things like preferred generics, preferred brands, non-preferred drugs, and specialty drugs. So tier 1 is typically very, very common generics that have been around forever. And then tier 5, we often see it's like new drugs where there's no generic available. It's treating something very specific. We'll see those sometimes in higher tiers. And again, there are programs that assist. So Extra Help is a federal program that helps people lower their drug costs that we're going to talk about in a little bit. So there's different costs for different prescriptions at different times. The different coverage periods are the deductible. So if you're in a plan that has a deductible, you have to pay that before the Part D plan kicks in. Then you're in the initial coverage period. So the plan is paying and you are paying copays at the pharmacy. Then also the coverage gap / the donut hole, it's important to know that that is basically ending. People, sort of next year should not experience what we've traditionally known as the donut hole, so we're not going to go too much into that. And then catastrophic coverage, it's like once people reach a certain dollar threshold in the year, their drug costs should go down. So just depending on if you have high drug needs, at some point you'll hit that catastrophic coverage. So just some coverage reminders. And these are kind of some of the things that we've seen popping up a lot during the public health emergency, the COVID situation. We've received on our helpline many questions about coronavirus, COVID-19 testing. So COVID tests are covered under Part B as a clinical lab test. It's anytime basically from February onward. There should be no cost sharing. So there should not be any co-insurance, no co-pays. Nothing associated with the COVID test should be, billed to the beneficiary. And plans cannot require prior authorization. So they can't ask you to have your doctor demonstrate that this is a needed service, because basically we know for everybody, if you're getting a COVID test, it is a needed service. You're not doing it for fun or for your own kind of curiosity. It is, not required to do a prior authorization. And so there is no coronavirus vaccine yet. Hopefully, eventually there will be, but we don't know. But it has already been determined by Center for Medicare Services that if one becomes available, it will be covered under Medicare Part B and will not have any cost sharing. So again, it's not out now. It is not to be confused with the flu vaccine. They are two different things. But if and when this COVID vaccine, coronavirus vaccine happens, then it will be covered. Another thing that has come out of the pandemic is adjustment to prescription refills. So Part D plans and Medicare Advantage plans that have Part D are required to cover up to a 90-day supply of a prescription at the beneficiary's request. So they can't put quantity limits, meaning they can't say, 30 pills in a month and then keep you to that. They have to give you the full 90-day supply as long as that's what you have a prescription for from your doctor. Some safety checks are still in place because unfortunately, on top of the COVID pandemic, we also have an opioid epidemic, and there are still safety precautions in place to kind of prevent, abuse and unsafe use of opioids. So that, has not changed. And also plans can relax restrictions and let people fill restrictions earlier. So in the past, we've seen, people, they might have a refill kind of limit. You can't fill it, 2 weeks early to kind of prevent people from getting more than their prescription is, in a shorter period of time. But again, that can be relaxed due to the public health emergency.
Sarah, before we move on to telehealth, can I ask a few questions from the Q&A?
Yep.
Okay, so this is a very good question here. Someone asked, so Medicare doesn't cover drugs, only available through a private additional insurance, a Part D or Medicare Advantage? Yeah,
so original Medicare A and B does not cover prescription drugs on an outpatient basis. Like if you were in the hospital, it would cover your drugs. But if you just have routine, you have your blood pressure medicine, cholesterol medication, you would need to select a Part D plan in order to have that covered, or, enroll in a Medicare Advantage plan that has Part D coverage.
So outpatient, inpatient is an important distinction.
So outpatient, yeah. So if you're an inpatient at a hospital, at a SNF, all your medications will be covered while you're an inpatient. But at some point you will no longer be an inpatient, and you may need medications after that. So then you really need to have a Part D plan in place for your drug coverage, yes.
Okay, and then how many, is there a limit to how many COVID-19 tests one can have at no cost in a calendar year currently?
Not that we've heard of, no.
Got it, thank you.
Yep. All right. So yeah, another thing we've received many questions about is telehealth. Now that people are potentially wanting to utilize telehealth more due to, risks associated with being out in public or being in communal spaces. Telehealth are services provided during a full visit with your provider using telephone or video technology, so things like Zoom that allow for audio and video. Some services can be audio only, meaning that it's through just the phone. So that's things like behavioral health care, so meaning, mental health counseling. And then basically, if you have any questions about the technology requirements and your doctor is somebody who is providing telehealth, they will most likely be able to assist you in understanding what you need to have a visit with them. Also, during the public health crisis, telehealth services are covered under Part B for all people with Medicare throughout the country. in a variety of healthcare settings or at home. So previously it was kind of more, there were more rules and restrictions around telehealth, and it has been expanded during this time while more people need to use it from home. So just some examples that are covered under telehealth. So hospital and doctor's office visits, behavioral health counseling, preventive health screenings. Healthcare providers who can offer telehealth services are doctors or nurse practitioners, clinical psychologists, licensed clinical social workers, physical therapists, occupational therapists, and speech and language pathologists. So these are just some examples. It's not the be all and end all, but these are the kind of most common situations that we've been seeing people utilizing telehealth. And I think it's important to note that telehealth is an option, it's not a requirement. People are allowed to still go for in-person visits if that is your preference and something that, you feel like you would get, a better treatment or a better visit. Telehealth is just an alternative, but you can still go in person. Telehealth costs, so they might have the just standard cost sharing associated with Medicare plans or Medicare, the original Medicare co-insurances, but providers can choose to waive that if they would like. Typically, providers are not permitted to waive cost sharing, but they can do so during this time. If people are in Medicare Advantage plans, then you need to contact your specific plan to learn about its costs and coverage rules. So behavioral health care, so this is, again, sort of mental health care. It includes services that are intended to help diagnose and treat mental health conditions and substance use disorders. Mental health conditions affect the way people are thinking about things or feeling their moods. So very common examples are depression and anxiety. Very uncommon example is schizophrenia. And then substance use disorders are included under this umbrella. So things like alcohol abuse, opioid abuse, drug abuse, those all fall under behavioral health. So mental health therapy is covered under Medicare Part B. In order to pay the least amount of the care for your care, you need to see providers who participate in Medicare, so they accept original Medicare, or if you're in a Medicare Advantage plan, they need to be a member of your Medicare Advantage plan, meaning they're in network. We often see that mental health care providers are more likely than other types of providers to opt out of the Medicare program, meaning neither Medicare or Medicare Advantage will pay for the care. So if you see an opt-out provider, it's very important to be aware that you'll be responsible for the full cost of services you receive. The providers really have to notify you of this in advance before you even receive any services so that you're not taken off guard, but it's important to plan out and be aware of those rules. Resources for help finding providers or accessing mental health services. So NAMI, New York, it's a mental health alliance. They have this helpline, it's really great. And then the Community Health Access to Addiction and Mental Health Care Project, abbreviated as CHAMP, which the Medicare Rights Center is a part of that program. They do also have a helpline. If you're struggling with these kind of issues, you can reach out to them for confidential assistance with your issues. So we've kind of touched on that these programs exist, but we're going to move on to programs that help pay for Medicare costs. So we have the Medicare Savings Program, Extra Help, EPIC are the three main programs. You have to meet the income requirements for all of these programs, and Extra Help may have an asset requirement. So we'll start with the Medicare Savings Program. So this is a program that provides help with Medicare costs. It is determined by income. At a state level, the income levels are kind of similar state to state. And asset limits differ state to state, but it's really important. And again, we're lucky that we're in New York, that there is no asset test for the Medicare savings program. So if you have money saved in the bank or in a retirement account, but you do have low income, you could potentially still apply. And we would encourage you to be screened for those benefits. Some states have higher income limits, and some states count different types of income differently. So in 2020, just sort of an overview, a snapshot of the program. The highest level is called qualifying individual. If your monthly income is $1,456 or less, you might be eligible for one of these levels. If you're a couple, it's $1,960 a month. But again, it's important to note that some types of income don't count or are counted not in full. So if you're around this threshold, or even if you're a little bit above, we would encourage you to be screened, because you might be eligible even if you kind of right off the bat assume you're not. So if you're a little bit above, we would encourage you to check in. It has these different levels. You don't get to choose which level you're in. They're kind of they all pay for the Part B premium, the $144 that we talked about previously. QI and SLMB can be retroactive for 3 months, so you would get reimbursed for 3 months in the past. And the QIMBY program has additional kind of cost-saving measures, which is from its own presentation. But if you fall under that QIMBY level, you know, there are additional benefits available to you. So again, they all pay for the monthly Part B premium, the $144. They all automatically enroll somebody, so known as deeming, into the Extra Help program, which assists with Part D costs. It eliminates the Part B late enrollment penalty. So if you think back to the beginning of the presentation, when we talked about the general enrollment period, potentially you could have a penalty if you didn't enroll in Medicare on a timely basis and you didn't have coverage from some other source. If you are eligible for the Medicare savings program, it will eliminate that late enrollment penalty, and it will eliminate it forever. So even if you down the line are no longer eligible for the MSP, your penalty is still gone. So it's a great benefit in so many ways. Next, we have Extra Help, which pays for Part D. It's through the federal government, so it goes through Social Security office. It only works with Part D plans. So if somebody had coverage for drugs through an employer plan, through a retiree plan, through the VA, Extra Help doesn't assist with those. It will only help with Part D coverage either through a standalone Part D plan or Part D received through a Medicare Advantage plan. It also provides people with a special enrollment period, so people can change their coverage or enroll in Part D for the first time if they are Extra Help eligible and enroll in the program and they need Part D. It's a way to get into Part D outside of the traditional enrollment periods. It's also known as the Low Income Subsidy, LIS. So LIS and Extra Help are the same program. People kind of use them interchangeably. So compared to the Medicare Savings Program, the income limits are a little bit higher, but it does have this asset test. So it's kind of like a trade-off. So you can just kind of compare your situation to this and see if you're eligible. So how to enroll in Extra Help. Some people get Extra Help automatically through Medicaid and the Medicare Savings Program, or if they're receiving Supplemental Security Income, SSI, not to be confused with just regular Social Security retirement income. You can also apply for Extra Help through the Social Security website. So the application is a pretty straightforward application online. You can find it through just the Social Security homepage or on the phone, or apply in person, which is not totally like all the Social Security offices are not open at the moment. So online or over the phone is definitely the way to go at this point. And you would just declare your income and assets. They don't require any documentation. And if your application is denied, you can appeal. They have instructions on the appeal process on the denial notice. So we also have EPIC. EPIC is a New York State program. It's a really great program that helps people 65 and up. So unfortunately, it doesn't help those other categories of people that might be eligible for Medicare due to disability or end-stage renal disease. But if you're 65 and up, it can help with their prescription drugs. They also get a special enrollment period to enroll in or change their Part D coverage during the year. It is separate from extra help, but you can have both. You know, if you have extra help, then you are definitely eligible for EPIC. But if you're eligible for EPIC, you're not necessarily eligible for extra help. And then EPIC has really generous, relatively, income limits. So compared to that like $1,400 we saw for the Medicare Savings Program versus the $1,600 we saw for extra help, it's all the way up to $75,000 a year for a single person and $100,000 for a couple. So just a few last resources. If you have any questions, we're always happy to talk to you. We have a helpline. It's open Monday through Friday, 10 until 3 p.m. If you do get the voicemail, please leave a message because it just means the counselor's not available, but we call 100% of the messages back. So if you can leave us a message, that will be really helpful, but we will definitely hopefully speak with you. Also CHAMP, which I mentioned previously, that helps with behavioral health or substance use mental health services. They have their own helpline, or you can call us. We are part of the CHAMP network that helps people understand their insurance in the context of behavioral health and how to get the services you need. Also, we have Medicare Interactive. This is our website. You can go to medicareinteractive.org, and it has, you know, you can type in any Medicare question, any Medicare topic, and it will, you know, guide you to different articles on those topics. They're meant to be written in kind of clear, simple, consumer-oriented language that really anybody can understand. And we get many, many visits on it. We're always growing the articles and adding articles to that on different topics. So I would encourage you to check that out when you have a moment, medicareinteractive.org. And then also on that same website, we have Medicare Interactive Pro. It's a webinar series that goes through all of these topics in, you know, much, much, much more detail. So if you would like to become, you know, more of an expert in Medicare, we would encourage you to check that out. It has quizzes, it has kind of modules that you work through on different subject areas. And so again, that is on our website, or you can contact Jay, our outreach director, at that phone number, Jay Johnson. He is a very nice man if you would like to speak to him. And then last but not least, we have a couple of newsletters. Dear Mercy, it's a newsletter that covers frequently asked questions. You can sign up on our website, receive it in your email, and it's every 2 weeks. And that is it. So if there are any questions, I'm happy to answer them.
Thank you, Sarah. We had one question that came up in the chat a while back where someone was asking about if they're retired and their job covers their medical insurance. Could you expand a little bit more on the type of protection that offers? Or
so it depends on the situation, but usually retiree is secondary to Medicare. So you would still need to enroll in Part A and B through the Social Security office. And then the retiree coverage would kind of link up with your Medicare coverage to provide you more comprehensive coverage. But the retiree coverage also frequently includes creditable drug coverage. So you might not need a Part D plan. They should send you a notice letting you know whether or not the drug coverage is equal to Part D coverage or not. But yeah, it does not protect you. If you don't have Part B and you only have retiree coverage, you might be potentially incurring a late enrollment penalty. So we would encourage you to, reach out to us if you want to talk about your individual situation.
Great. Okay, thank you so much, Sarah. I just want to show everyone once again the website here, seniorlawday.info. The slides from today will be posted there. There's a lot of information, so of course you can reach out to the Medicare Rights Center for more specific questions. The Westchester Library System also has a senior benefits and Medicare information resource, a helpline where we offer one-on-one counseling. So this is another opportunity that you could use to get answers. And I think I'll leave it on this slide. Thank you to all of our sponsors that make Senior Law Day a thing, that make this happen. And I believe we're going to open up a poll. Is that right, Bruce?
That's right. I'm launching it now just for you to give us some feedback. So please answer that and give us some feedback, and then you can leave the webinar. So anyway, thank you so much, Sarah and Krishna. Sarah, you really did like a marathon there. I don't know how you covered all that material, but I'm pretty impressed and learned a lot. So thank you so much.